Finish our discussion of inspection. So whatever findings we have done on inspection, that we are going to confirm with palpation. Okay, now we are going to use our both hands. We are going to palpate organ, that is chest. So in palpation, first you will see the expansion of chest. Isn't it or not? Whether chest is expanding equally on both sides or not. In inspection you observe whether it is expanding by inspection, but now we will touch the chest and we will try to see whether chest is expanding on both sides or not. For that purpose, you just see method. I am going to touch my both thumbs with each other. The fingers are spread away, and I am going to place this finger first in upper part of the chest, that is in the axilla, then at the middle part of the chest, and then at the lower part of the chest. And I will say the person to take breath in. As soon as he takes breath in, this thumb will get spread away from each other. And when we will do expiration, both this thumb will again touch to each other. When the person will inspire air, this thumb will go away from each other, and in expiration it will touch. Are you getting it or not? You have to place it lightly. You are not supposed to do pressure on the chest. I will demonstrate two methods like this. Okay, I am placing my hands like this. घ्या श्वास घ्या मोठा घ्यायचा. Okay, now he is taking air in. Software. Out. See whether my thumbs are moving or not.
Yes.
Going away, again meeting each other. Okay. In inspiration they are going away. In expiration they are again meeting to each other. They are touching to each other. So I will repeat it at the middle part like this. मोठा श्वास आहे बाबा. Okay. See my thumbs are moving away, again touching to each other. In inspiration they are going away, in expiration they are touching to each other. And at the lower part of the chest I will perform. So I will perform this act on front side. I will perform the same act on back side in the same way. Okay, like this. Here, upper part of the chest, here श्वास हात मोठा. Okay, here at middle, at lower, and for apical examination I am going to place, I will stand behind the subject and I will place my both hands on both shoulders. Okay, these thumbs will touch to each other and I will ask person to take breath in. Yeah, Sora. See, these thumbs are moving away and again they are touching to each other. Okay, so in this way you can see whether this particular movement of the chest is equal and symmetrical on both sides or not. You know, there are certain diseases in which the movement of chest get affected. For example, if the person is suffering from pneumonitis, right-sided, definitely the movement on the right side of the lungs will get diminished. It will not move, isn't it or not? If there is pleural effusion on right side, again the movement is diminished on right side. And only one side, the normal side, will move. So that in that way you can just go for the diagnosis of disease. The next is position of trachea. You know trachea, now we have to do palpation of trachea. In tracheal notch. At tracheal notch, you can use just thumb or middle finger or index finger. You can just place it at tracheal notch like this, in between two sternocleidomastoid muscle. You just push it inside and try to fill the tracheal rings. Yes, I could able to fill tracheal rings like this. So you can say that trachea is centrally placed. Okay. Next is apex bit. in cardiovascular system, we have already discussed regarding apex width. So I will not go in detail, but I will go for tactile vocal parameters. Tactile vocal parameters is the next examination. When person is talking, vibrations are created. Okay, when person is talking, vibrations are created at vocal cord, and these vibrations are transmitted to the chest, and that we have to feel by ulnar border of your head. Very simple. This is definition of tactile vocal parameters. While talking, the sound waves are created at vocal cord, and these vibrations are transmitted at chest, and the examiner has to feel it by ulnar border of his head. I will demonstrate you how to perform this examination. For performance of this examination, you have to ask person to say 9, 9, 9. Why 9? Because 9 word is nasal word. It creates more vibration. That's why usually the examiner is asked to say 9. Okay, the rest of the words are not nasal words. So always you do it in comparison manner on both sides, and you place ulnar border of your hand at intercostal space and not over ribs. You have to place it at intercostal space. Okay, always comparison. You cannot perform this examination only from one side. You have to compare right side with left side and place your ulnar border at intercostal space in horizontal direction, like this. आपण 9 म्हणायचं हळूहळू बरं का, 9 असं. 9 right, 9 slow. So I have place it at first right side. No. Okay, I am doing it at frontal region. बोला. No. Good. मोठ्याने बोला. No. So this is frontal. At the side. बोला. No. Okay. On this side. No. Okay. No. So I am feeling vibrations to my ulnar border of the hand. At the same way back. Comparison. Okay. बोला. No. So this way the examination is performed. So tactile vocal parameters, in this case it is normal on both sides. TVF, tactile vocal parameters, is normal on both sides. If the person is having pneumonitis, this TVF get increased. Tactile vocal parameters, you will get more vibrations over consolidation pneumonia. Isn't it or not? And if, for example, if there is a pleural effusion, or you can say air in the pleural space, pneumothorax type of condition, again this TBF get decreased, becomes less. So these are few conditions, abnormal conditions that you should also know. In chronic obstructive pulmonary diseases, TBF decreases, and even in asthma, sometimes TBF get decreased. So these are few disease conditions in which TBF decreases, and this is everything all regarding the palpation of respiratory system. Right? So you try to perform this examination on your